What is Asperger Syndrome? Part 2. What symptoms define Asperger Syndrome? Asperger Syndrome, often abbreviated to AS, is widely considered to be an Autistic Spectrum Disorder, or ASD. It is characterized by significant difficulties in social interaction and communication that interfere with an individual's normal functioning, along with repetitive and often restrictive patterns of behaviour and interests. It differs from other forms of autism in that there is no mental retardation. In other words, linguistic and other cognitive abilities remain largely unaffected. Because of this, Asperger syndrome is described as a high-functioning form of autism. Unusual use of language, however, is common. Similarly, physical clumsiness is often reported. Whether or not Asperger syndrome should be considered a form of autism remains unclear. Its classification within the autistic spectrum is to some extent an artifact of how autism itself was discovered and may not reflect its true nature. However, both autism and Asperger syndrome fall under the diagnostic category of pervasive developmental disorders, or PDD, which are characterized by delays in the development of multiple basic functions, including socialization and communication. The exact cause of Asperger syndrome is unknown. Although research suggests the likelihood of a genetic basis, there is no known genetic cause. Brain imaging techniques have not produced any common results either. Social interaction. Individuals with Asperger syndrome experience difficulties in the basic elements of social interaction. This may include a failure to develop friendships or seek shared enjoyment, a lack of appropriate social or emotional responsiveness, and impaired nonverbal behaviours such as lack of eye contact or facial expressions. The unaffected cognitive ability of children with Asperger syndrome often allows them to articulate socially accepted norms under laboratory conditions, where they may be able to show a theoretical understanding of other people's emotions. However, they typically have difficulty acting on this knowledge in real-life situations. People with Asperger syndrome may not appear to be as withdrawn around others as those with autism, but the majority do experience some degree of social awkwardness that may result in withdrawal. In most cases, they are able to approach and converse with others, even if it causes them some distress. However, not all individuals with Asperger syndrome feel comfortable approaching others. Some may only talk to people they like or are familiar with, while some may even display selective mutism, speaking only to specific people. Someone with Asperger's may occasionally go to great lengths in order to avoid social interaction of any kind. Failure to react appropriately to social interaction may sometimes appear as disregard for other people's feelings and may come across as insensitive. A person with Asperger syndrome may engage in a one-sided, long-winded speech about a favourite topic, while misunderstanding or not recognising the listener's feelings or reactions, such as a desire for privacy or a need to leave. Someone with Asperger syndrome may analyse and distill their observations of social interaction into rigid behavioural guidelines and apply these rules in awkward ways. A desire for companionship can become numbed through a history of failed social encounters. Behaviour. People with Asperger syndrome often engage in behaviour, interests and activities that are restricted and repetitive and are sometimes abnormally intense or focused. They may stick to inflexible routines, move in repetitive ways, or preoccupy themselves with parts of objects. Pursuit of specific and narrow areas of interest could be considered one of the more striking features of Asperger syndrome. An individual with Asperger syndrome may collect volumes of detailed information on a relatively narrow topic, such as weather data or star names, without necessarily having a genuine interest or understanding of the broader topic. For example, someone might memorize camera model numbers while having no particular interest in photography. Although these special interests may change from time to time, they typically become more unusual and narrowly focused and often dominate social interaction. Because narrow topics often capture the interest of children, this symptom may go unrecognized. Repetitive motor behaviours are a core part of the diagnosis of Asperger syndrome and other autistic spectrum disorders. This can include hand movements such as flapping or twisting, or complex whole body movements. These typically look more voluntary or ritualistic than tics, which are usually faster, less rhythmical, and often less symmetrical. Communication. Although individuals with Asperger syndrome acquire language skills without significant general delay, and their speech typically lacks significant abnormalities, their use of language is often atypical. Abnormalities may include speech or writing deemed to use an excess of words, abrupt transitions, literal interpretations and miscomprehension of nuance, use of metaphor meaningful only to the speaker, unusually pedantic, formal or idiosyncratic speech, and oddities in loudness, pitch, intonation and rhythm. Repetition of words or sounds made by another person, known as echolalia, has also been observed in some individuals. Differences in auditory perception may also exist, meaning that the person does not process the information they hear in the same way as others do, which leads to difficulties in recognizing and interpreting sounds in the same manner, especially the sounds composing speech. Many people with Asperger syndrome tend to use a more sophisticated vocabulary than their peers, but may have difficulty understanding figurative expressions and tend to use language literally. Children with Asperger syndrome appear to have particular weaknesses in areas of non-literal language that include humour, sarcasm, irony and teasing. Although individuals with Asperger syndrome usually understand humour, they may lack an understanding of the intent of humour to share enjoyment with others. Despite evidence of impaired humour appreciation, reports of humour in individuals with Asperger syndrome seem to challenge some of these psychological theories. There are three linguistic aspects of clinical interest regarding identification of Asperger syndrome. These are observed verbosity, unusual prosody, and tangential and circumstantial speech. Verbosity is the use of an excessive number of words. Prosody is the intonation or variation of pitch, stress and rhythm of natural speech. Tangential speech is when the train of thought of the speaker wanders away from the original focus, never returning to the initial topic of conversation. Circumstantial speech is when the speaker wanders but eventually returns to the original topic. Although the inflection and intonation of someone with Asperger syndrome may be less rigid or less monotone than someone with autism, people with Asperger's often have a limited range of intonation. Their speech may be unusually fast, loud or jerky. Their conversational style may often include monologues that fail to suppress internal thoughts, bore the listener, or fail to provide context. Individuals with Asperger syndrome may not monitor whether the listener is interested or engaged in the conversation. Their conclusion or point may never be made, and attempts by the listener to shift the conversation to a related topic may be unsuccessful.